Grab your foam roller. We're gonna roll out our hip flexors. We'll start with our dominant or tighter leg. The other leg will be out to the side, the knee will be bent, kind of like in a butterfly position. So you're rolling one hip flexor at a time, starting up at the thigh groin area. Arms are down, forearms are down on the floor for stability. So go ahead and begin that. Dominant side first, rolling out the hip flexor, getting into that fascia. And notice what happens with your abs here. Do you push the belly out? Can you keep it in and breathe laterally into the side body and back like an opera singer would? And every time you exhale, can you make sure your abs are in towards the spine and that you tug up on the muscles that stop your stream of pee? So we contract that deepest layer of your core, the transverse abdominis. If you're confused about TVA breathing, make sure and check out our TVA breathing versus belly breathing, level 1 under mind and body. It's a great just tutorial on how to breathe safely if you have any back issues. Couple more breaths here, breathing in. And let's go ahead and switch sides, setting up on the other side, bracing the abs to do so. You can do circular motions. You can walk forward and back. Make sure you're pushing down with the forearms and out like you're trying to split your yoga mat in half, engaging the scapular stabilizers. If the neck is straining, lift the chin a little bit. Make sure your focus of your eyes is not just straight down in front of you, but about a foot forward so that the eyes are lifted and the front of the neck is engaged. Plug the shoulders down, firm the low belly in towards the spine. Keep rolling, rolling, rolling. All right, 2 more breaths here. Inhale, 2, 3, 4, and exhale, 2, 3, 4. 1 more. Inhale, 2, 3, 4, and exhale, 2, 3, 4. From here, let's put the blue loop band around our outer thighs and grab either a yoga block or pillow for your head because you're going to use the small anti-burst ball against the wall. So we'll set up in a fetal position. In this fetal position, you'll have to play around with how close you are to the wall. You want to pin, you want your dominant or tighter leg to be stacked on top, so you may have to spin around. Brace your abs, make sure the head's supported. Make sure you're not rounding your low back, but tip your pelvis back. Find a neutral pelvis. From here, we'll bend and extend that dominant leg with the leg lifted up so that the legs are a little more apart than hip distance, so a little farther apart than hip distance. So you have this blue loop band's resistance for the abductors of the legs. As you extend the leg, dragging the ball on the wall back and forth, you're getting workout for the hamstrings, the outer hips, the butt muscles. Watch out for rocking back. Keep your hips stacked. Keep your pelvis neutral. That's somewhere between arching and rounding. Low belly firm. Shoulders plugged down, chin lifted, gaze soft. Imagine hands on the shoulder blades, puff the back ribs towards those hands, firm the low belly in towards the spine. If at any time you need to pause, take a break, do that. We have 1 minute remaining on this side, moving the ball in and out. I like to exhale as I extend my leg without locking the knee at the end, and then inhale as I bend it back in. If you need to take little breaks in between, feel free. This is a tough workout for the glutes and a weak area of the body posturally with lordosis. So keep breathing. I'm going to cue the breath. I want you to keep going. Take pauses when you need to. Inhale, 2, 3, 4, 5, and exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. You've got this. 2 more. Inhale, 2, 3, 4, 5, and exhale, 2, 3, 4, 5. 1 more. We inhale, 2, 3, 4, 5, and exhale, 2, 3, 4, 5. Brace your abs. Make your way to the other side, setting up, negotiating between how far away from the wall you should be so that you can pin that ball successfully. Neutralize your pelvis by tipping it back a little so you don't round it under. Pull the belly in instead of pressing it out. Think about breathing into the side body, especially the side body that's facing up to this ceiling now. And then plug the shoulders down. Imagine someone has your pelvis, they're pulling it down towards your heels, lengthening your side body and your low back out. Keep your low belly firm and begin when you're ready. Extending that top leg, making sure you've lifted it up a little higher and a little wider than hip distance apart so that you feel the lateral hamstrings and that glute med activating. And then from the knee joint, we're just extending the shin and then bending the knee, dragging that ball on the wall forward and back. Make sure you're using the breath, connecting to the breath, lifting internally up on the muscles that stop your stream of pee. Fogging a mirror every time you exhale. Sounds like Darth Vader. Keep that breath going. We inhale 2, 3, 4, 5, and exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5, and exhale 2, 3, 4, 5. Almost there. We inhale 2, 3, 4, 5, and exhale 2, 3, 4, 5. 2 more. Inhale 2, 3, 4, 5. Take breaks if you need to. 1 more. Inhale 2, 3, 4, 5, and exhale 2, 3, 4, 5. From here, we'll take off this blue loop band, bringing our red loop band around our outer thighs. We'll take the blue loop band and grab our blue Theraband, threading the blue Theraband through the blue loop band to create what looks like a reformer strap, coming to all fours for some hamstring kickbacks. Start by putting the blue loop band, after you have the red loop band around your outer thighs, around the arch of your dominant or tighter leg's foot. You can wrap the blue Theraband around both hands' knuckles or around the same side of the body as the band that's on the foot. So either or. Plug the shoulders down, wrists are under the shoulders, knees are under hips. We'll be extending that leg back, bending at the knee. So it goes out, 2, 3, 4, and in. 2, 3, 4. Inhale it out. 2, 3. Let's actually exhale out. So pause for a second. Puff your upper back up towards the ceiling. Plug the shoulders down. Lift your chin. Take your gaze a little higher than eye level. Inhale, take it out. 2, 3, 4. Hold it out for a second. Watch out for your pelvis hiking. Square your pelvis to the floor. Brace your abs. Exhale the air out. Now inhale it in. 2, 3, 4. Exhale to go out. 2, 3, 4. Inhale it in. 2. Keep your pelvis neutral. Don't round it. Don't round the pelvis when you bring in that leg. Make sure you're not rounding it. So exhale it out. 2, 3, 4. Inhale it in. 2, 3, 4. Exhale out. 2, 3, 4. Inhale in. Keep the abs firm, chin lifted, gaze soft, shoulders plugged down. Puff the upper back up towards imaginary hands or towards the ceiling. Don't hike your hips. Keep the hips even, low belly firm. Fight for a neutral pelvis, somewhere between arching and rounding. Top of the shin and foot is down on our supporting leg side. Finish up the one you're on and go ahead and set up on the other side for our hamstring kickbacks. Once you are set up, you can begin. Remember, inhale, prepare, brace the abs. Exhale, take it back. 2, 3, 4. Point the toes. Inhale in. 2, 3, 4. Exhale out. 2, 3, 4. Inhale in. 2, 3, 4. That's all it is. Exhale out. 2, 3, 4. Inhale in. 2, 3, 4. Keep that going. As you're working, make sure your elbows are micro bent. Your chin is lifted. Your gaze is soft. Your shoulders are plugged down. Your toes are pointing. You're not locking the knee out as you extend the leg behind you. You're not hiking the hip. Those bony protrusions on your hips are shining like headlights to the floor. Hips are even. Low belly's firm. 3 more breaths here. Inhale, 2, 3, 4. Exhale, take the leg out. 2, 3, 4. Inhale it in. 2, 3, 4. Exhale it out. 2, 3, 4. Last breath here. Inhale, 2, 3, 4. And exhale, 2, 3, 4. Setting those bands to the side. Pick up your black Theraband, come to lie on your back, take your dominant or tighter leg up, putting the band around the arch of the foot, tip your tailbone down, create a mouse hole between the low back and the floor. Make sure you're not rounding the low back or arching it so much that you could put multiple hands under the back. Neutral pelvis, slide the other leg out long, hold it here. Inhale 1, breathe. Exhale 1, just opening up the back of that hamstring after all that hard work. Inhale 2, exhale 2, inhale 3, exhale 3, 1 more, inhale 4, exhale, bend the knee, Capture the other foot in the band, stretching it up, trying to not lock out the knee, but keep the leg pretty straight. Other leg extends out, neutral pelvis, belly in, breathe laterally into the side body. Inhale, 2, 3, 4, and exhale, 2, 3, 4. We inhale, 2, 3, 4, and exhale, 2, 3, 4. 2 more breaths here. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Let's inhale, 2, 3, 4. Bend the knee, lowering that leg down, setting the band to the side. Great job.